You know I'm pretty.
Good morning out there. This is Steve Stites, Chief Medical Officer of the University of Kansas Health System. We're broadcasting live from the Dolph Simons Family Studio. You know, you think I could be able to say that right by now. I know I can get out there someday. I'm with Keith Sale on my left, actually.
There we go.
You know, all day yesterday I kept calling Keith David. So this is the real David Weil, but I'm going to call him Keith today just to even things out. Also, Dr. Hawkeye, Dana Hawkinson, our Medical Director for Infectious Disease and Control, and Infectious Prevention and Control, and then Terry Sue, who is our Physician-in-Chief of our Cancer Program and Vice President of Physician Services here at KU. So welcome everybody out there. So let's first turn to Dr. Hawkeye here. So Doc Hawk,
Hi.
how are things going this morning?
Yeah. Things are good. Again, I think we have been cautiously optimistic about our numbers the last few weeks. Currently, we have 20 patients in-house. Half of those are in the ICU, and so hopefully, and it looks like our numbers are going down, as we now begin to open up or ease some of our restrictions as we get into that period. Hopefully they will continue to stay down. We'll see what our new baseline is. We expect a new baseline, but I would also like to mention that as we do open up and we are starting to escalate and accelerate some of our processes and our ability to do things here for our patients. And as far as infection prevention goes, we have been working very hard this past week to really put in the final procedures to make everybody safe when they do start to come in for clinics and procedures and those types of things.
Thank you. And it does feel like we've really bent the curve or flattened the curve for now. We're living in what I believe to be, or we think is a new normal. But you spent a lot of time, David, Keith, whatever your name is, of trying to help us model what's going on out there. I know you work closely with the School of Medicine as well as the state and local and county governments to think about what does it mean, where are we on the curve, what curve should we be following, and what's a likely occurrence once we start opening things up. People go back into society. What thoughts do you have around that?
Yeah, that's a loaded question.
It is a loaded question. It's a long one. Remember, we've only got a few minutes today.
So I think as we really pay attention to what we see happening in our communities, it's probably become very clear that there's not a single curve. The number of hospitalizations in Missouri, for example, has continued to decline across the state with the exception of the St. Louis area. And I think that's having some impact on the number of patients that are hospitalized here in our hospital. When you look at the state of Kansas as a whole, the hospitalizations are flat. But that's not so much true of our hospital and our communities, maybe the counties that primarily come to our hospital here. And those sort of that flat level of hospitalizations across the state is primarily being impacted by some of the more rural areas or Wichita at the moment. And so that's a long-winded way to say I think that each community is probably at a different place or has its own curve. But for us right now, it does appear that we're flat or slightly down, and that's a good thing. I mean, it definitely means that hospitals aren't overwhelmed, which was one of the key points in social distancing and stay-at-home orders from the beginning.
Yeah, and we should be a little concerned, I think, about what does happen when society opens back up.
Yeah, I think that there's no doubt that many of us who have spent a lot of time studying what transmission of the virus and infection means in the community, and no doubt a very large portion of our population has yet to be infected. And so more movement, more contact from individual to individual definitely increases the likelihood of new cases and of new people needing to be hospitalized.
Terry, I know you've spent night and day down in the Cancer Center working on how to keep cancer patients safe. Talk to us a little bit about some of the special risks cancer patients face, what we're doing to keep folks safe, as we know that people are nervous to come back to medical care.
Sure. Well, welcome and good morning from the Richard and Ed Block Cancer Care Pavilion, and thank you for having me on this morning. That is true. We do know that cancer patients, because of its impact on the immune system, certain kind of cancer patients more so than others are uniquely vulnerable to COVID infection. In fact, they have twice the infection risk of the general population. Now, we have to put that a little bit in perspective, and we think that phenomenon is not necessarily only because of the innate disease that they have cancer, but because they have so many visits and so many times outside the house involved in their cancer journey. And so some of our initial efforts have been to mitigate that risk by a major conversion. About 1/3 of our visits now are done via telehealth. So there's not this in-person, face-to-face, going through registration, waiting in the waiting room, going into the clinic room and checking out process. And the frequency of those in-person visits has decreased significantly without really impacting the overall care. So that is going to be a new care paradigm for us in terms of being responsible and keeping our healthcare workers healthy as well as keeping our patients safe.
Yeah, it's such a big deal because you still want to get care. And I'm going to ask all of you to weigh in. Where are you more at risk, Home Depot or the grocery store versus the cancer center or one of our other clinics? So I'm a patient, and I here at the health system, and I go to get care, and I still feel pretty safe. And admittedly, I'm a little biased, but what do y'all think?
Yeah, I've been asked this question since day one, and I've always said I probably do anticipate getting it because it is out there in the community, but I won't get it here at the health system, at the hospital. Because I know that we have our protections in place, we have our training, we have all the healthcare workers working towards keeping each other and especially our patients safe. So, yeah, absolutely.
Yeah, I agree. I think we've known for a long time that one of the key tenets in preventing the spread of disease in a hospital or anywhere is cohorting patients, is separating those who have the disease or who are likely to have the disease from those populations who don't, and even being more aggressive about that separation and those physical controls for at-risk populations. And so for those coming into the hospital, I think that's absolutely true. I was sent a picture from a neighbor over the weekend of Home Depot, actually. It's funny that you give that example.
I was there last week and to get shelves, and it was a little bit of a disaster. I had to go up and take a shower after it. And on Home Depot, I like. It's not bad about Home Depot. It's just, it's where people are getting congregated. I don't mean anything about it. Home Depot's great. But last Saturday was a little spooky to me. Terry, what about down with at the Block Cancer Pavilion? I know you guys are doing those things. Cancer surgery itself, what do we think about that?
Yeah, well, just to say, we have been open, we are open, and we will remain open. Unfortunately, this dreaded disease of cancer has continued to occur. It doesn't have any bearing on the virus being in play in the community at all. And so we have been very busy taking care of patients. Our volume is down probably less than 35%. And our treatments are down less than 11%. And really, we've continued business as usual with all these added precautions on top of where we are to try to keep our patients safe. And we've not had any cancer patients that have received the infection or gotten the infection. We've not had any healthcare workers within our area get them from a patient transmission. So all the cleaning measures, all the social distancing measures, all the impact that we've been able to employ have been able to keep the patients safe. We did see an initial dip, I think, after with some fear after the initial news came out about the pandemic, but now we are seeing a pretty steep trajectory increase in the amount of new patients because I think people are understanding that the risk of suffering from their diagnoses and a cancer diagnosis is much, much higher than the fear and the actual risk of getting COVID and having impact on COVID and COVID infection. Cancer surgery has been going on. We've not stopped that. Those are urgent surgeries. Certainly those cases that have comparable non-surgical approaches, we've leaned towards those approaches, but that's a very independent, personal one-on-one discussion with the physician.
Makes sense. It's interesting. I think the irony of this is that we've done so much work around infection prevention and control now that whether it's COVID or any other transmissible infection, we're probably actually safer than we have ever been because we're so vigilant about this one thing. But I mean, I think it's what happens is that extends to every infectious disease. So the strange truth is we actually may be a safer place than we were 3 months ago. And I think that's true for healthcare in general. Well, questions out there from our listeners, and our media team out there. What do you have this morning? I'm not hearing anything. So, Nate, do we have any questions from some of our audience that are coming through?
Yep. We do actually. Somebody hopped on a little bit early and was asking about students who have been quarantined since March are now getting restless and they would like to hang out with a few friends. What should this look like? And she was thinking outside, 6 feet apart with masks. Is this overkill, too lax? What are your opinions?
All right, Doc Hawk, what do you think? Hanging out with your friends.
Yeah. I think we have always stressed the importance of the physical distancing and adhering to public health guidance. We understand that there are spiritual, emotional types of problems that are going on and issues when we can't be around our friends and our loved ones. It's very important. I was talking with a friend the other day who the father is in hospice care, and that's very difficult. So dealing with family and friends when you can't see them on a regular basis is very hard to do. Again, I think as we start to lessen our restrictions and open up, that will become more of an issue. But we need to remember personal responsibility and things that we can do individually to reduce those risks. I think being outside is not a problem. We've always said that. If you can maintain your distance, if you cannot be sharing drinks or touching each other, hugging, handshaking, things like that, I think you're going to be fine. But again, we also do have restrictions on group numbers, so that needs to be taken into account as well. I think if you can do all those things, and especially being outside and not in an enclosed space, wearing your mask, I think it's probably a lot better, and you're going to reduce your risk of getting it or spreading it to another household.
So let me ask the two of you, because I know you guys have spent a lot of time, we all spend a lot of time on these questions, but if you're outside and you're more than 6 feet apart and you can maintain 6 feet apart, do you need a mask as well? Come on, fess up, guys. Let's
I
go.
would say from the pure science part, especially if you're outside, you probably do not. The mask was especially recommended if you can't maintain your physical distance or if you're in an enclosed space.
I agree. There are some simulations that you've seen that kind of show what a sneeze in an enclosed space looks like, and that 6 feet isn't a magic number, right. That 8 feet is better than 6 feet and 10 feet is better than 8. And that's probably true to some extent, but I think, right, every foot away, if you will, that you get, the less the risk. Mm-hmm. There's probably a small benefit of source control even outside, but I think realistically the impact of that on transmission, if you were 6 feet apart and outside and not touching horizontal surfaces, is probably small.
I think it is really too. The other thing, I believe it's in the New England Journal of Medicine, there's a letter to the editor coming out today about stuff hanging in the air. But once again, we don't know if it's a virus or just pieces of a virus or little parts of the RNA. We don't know if it's infectious. And I think what we will find is that history will prove that it's not. Mostly because we're not seeing that type of airborne infection being, because otherwise we'd all have it, because we'd be running into clouds of viral particles all around us all the time. Mm-hmm. And that's not how we're seeing it. You really have to have a little more direct transmission.
Or our caregivers in the ICU, where we have our most critically ill patients with COVID-19, when they aren't, or haven't been always wearing the mask or the proper airborne precautions just out in the hallway, haven't come down with the disease.
Yeah, I think it's going to be, I don't think that's going to be the way it's transmitted. So, other questions?
Yeah, I have another viewer who says that she lives in Johnson County and her elderly mother lives in her own home in rural Kansas. When will she know it's safe to visit her mother without putting her health at risk?
Oh boy, this is a question. This is going to be fun because this is one of my pet peeves, and David and I and Dana both know it, so we're probably going to get into it.
Yeah.
All right, David.
Well, I think this actually goes back to maybe an answer previously here, that each area is on their own sort of curve. And, we've heard from across
and
the
by
state.
that you mean rural Kansas is a different
Each
curve
community,
than Johnson
yeah.
County. Yep. Because the disease got there later, and so it's going to have a little bit later ascendancy.
Yeah, and I think we've heard a handful of times from patients and from providers even across the state that there is a perception, especially in areas where the population density is lower or the area is more rural, that this is not a disease of rural areas. And I think we've seen over the past week or two in Kansas as well that isn't always the case. And so I think that the best answer I can give you about when is we don't know. We just don't know. But there are many steps that you can take to make that visit safe to your mother. And I think you probably can do things in a way that includes physical distancing, lots of hand hygiene, appropriate use of masks that would make that visit as safe as possible, because I don't think it's going to be magically in 1 week or 1 month that it is safe to not do those things.
Yeah, I agree, absolutely. I think, again, we are getting into the same topic we were just talking about. I think it's all about risk mitigation. And, even more than friends, we need to see our loved ones. And I think if you can do the things individually to reduce your risk of spreading it if you have it and don't know it, or from getting it from somebody who might have it and doesn't know it, I think that's going to be the most important thing to do, because, we are coming on quite a few weeks now where we haven't really been able to see those loved ones that are close to us. And I think people are really starting to get antsy about that and really want to be able to do that, and they should be able to do that. But continue to do those things to reduce your risk as much as possible.
Yeah, I think the lack of testing randomly is, we really don't know what the prevalence is in different communities. And we don't really know how many people have it. We don't know how many people don't have it. And so, it was one point when we were trying to prevent stuff from coming in. Now it's mitigating the risk. And I just don't know that of getting in a car and driving from one spot to another spot, what's the magic distance? What's the magic travel time where suddenly you're increasing risk? And I don't know that that's true anymore. I'm not sure that travel makes as much of a difference when the disease is everywhere. And I think the real question for this person's mom isn't really how far away you are, but whether or not, even if they are across the street, you should visit them. Because I think the bigger question is that one. It's not how far away you are. And so I think if you break it down into what the real question is, then I think you'd get a better answer. And I think at that point it becomes, what can you do around infection prevention and control to make sure you keep folks safe? And I think that's really it. I had one of my patients in clinic, and Terry, I'm going to ask you this to comment on it, because you got to be having the same question at the cancer center. One of my patients yesterday, who's immunocompromised, asked me if a significant other could come over to their house, and some folks out there in society are starved for intimacy and personal contact. What are you telling cancer patients about that?
Yeah, we are seeing that as one of the consequences we are seeing with a lot of changes in the physical nature and the interpersonal nature of the relationship with the cancer patient. I mean, now when I walk into a clinic room, I'll have a mask on. And so that expression, the emotion within the face is much different. The physical touch is much different than what we have seen in the traditional cancer and physician cancer patient relationship. And it is something we are struggling and we're trying to figure out what the new normal is. We've tried to envelop the patient in other types of virtual comprehensiveness in their care in terms of benefiting from our oncopsychologists and other touches of different professionals within the cancer center that have really helped them feel that the same quality of care, the same loving interpersonal relationship is going on. And in fact, when we do things virtually with telehealth, there's a lot more probably conversational time that's spent with the patient, and so that's an added benefit of actually converting some of these appointments over to telehealth appointments. But we are still figuring it out, and our patients and us personally are struggling because the nature of the relationship has changed a little bit, and the new normal is being defined.
I think that's true. Other questions?
Yeah, this is probably more for Dr. Sue. When will mammograms start again? And can they speak to the daily radiation treatments? Are they safe to continue?
Yeah, great questions.
Sure.
And throw the cancer screening stuff in there as beyond mammograms and maybe even CT chest for tobacco users, et cetera.
Correct. We have and are in the process of reinitiating our kind of worried well non-cancer screening exams to really capture any problems at a very early stage. That was deferred up to this week, and we are ramping that back up because of the change in the COVID environment. And so that's an important part of detecting cancers early and getting in front before they become more and more problematic. And we've been able to detect several small cancers, as Steve mentioned in our lung cancer screening program, and really help save lives because we've been able to intervene much earlier than if traditionally they've been detected. I'm sorry, in the second part of the question.
Well, I was wondering about CT screening and for different like lung cancer, but I think that you've answered that. If we're starting in mammograms, I suspect we're going to start other areas as well.
I think
Yeah, and all the diagnostic. Go ahead.
I was only going to say that regardless of what the screening testing might be or the diagnostic process might be, that there are a number of steps that we've taken. I think part of the question here is it safe to do these things, right? One, when are you starting them? And two, how do I know it's safe? And I think there are so many things, the radiation treatment part of that question I think was getting at this as well. So many things that we're doing to keep our patients safe in the ambulatory environment, right? People who come and go, patients who come and go for their treatment as part of a cancer program or anything else related to masking, physical distancing inside our hospital or our waiting rooms or our clinics or the CT scanners. And then actually I think it ties into some of the surgery comments you were making earlier, Terry, and I don't know if you want to jump in here, but testing of pre-surgical patients as part of a way to say this is safe for you, your treatment or the process of coming here is safe.
Correct. And we are also testing patients prior to radiation therapy and prior to initiation of chemotherapy and in between chemotherapy cycles. So at every major stage, we are testing patients to make sure that the treatment decision is the correct one to protect the patient, to protect the patients around the patient, and to protect the healthcare providers. Radiation treatments have been unabated. Their volume is even less, has been less impacted. We've had no infections involved, and I think it's because we've been very vigilant about all the physical distancing, all the hygiene, the heightened environmental care cleaning that goes on every single day, the decreased interactions with the number of personnel. We're clustering care, so the number of people that come adjust the patient, move the knobs and dials has been minimized to the minimal risk of interfacing with another person during those treatments. These treatments, again, classically radiation treatments last 15 to 20 minutes, so they're very, very fast interactions as well. So we've really not seen that to be a problem, again, in really near full volume in the cancer center. We're actually a little bit worried about hyper volume because there's been this kind of pent-up fear. People have been staying home with symptoms, and now as the diagnostic and screening exams open up even further, we're worried that we'll have kind of a surge of our own going on, and we are preparing for that with our new normal procedures.
How long after cancer therapy, be it chemo or radiation, do you have a sense that it takes for patients' risk around COVID to return closer to normal? Is it just when they're getting treatment, or does it stay with them forever?
Yeah, we don't know the answer to that. We are studying that under Dr. Weijing's Sun as well. There's two national databases that are help wrap their hands around that particular question. We know particular types of surgery and particular types of radiation are not really going to be too impactful to the patient's risk because they're not in aerodigestive parts of the body, so they just really probably are not as impactful on that risk to the patient. We think the risk to the cancer patient overall is less on its immune system, but more on because we need to see those patients more. They have to come in for laboratories, they have to come in for x-rays, they have to come in for exam visits. So we're trying to balance that need for them to come into what is safest for the patient. And so we're still figuring that out. We know that many types of immunotherapy and other types of chemotherapy don't suppress the immune system to make the patient as susceptible to viruses as maybe probably hemalignancy type treatments or bloodborne type cancers. We do know also that there's some preliminary evidence that certain patients on certain types of therapy actually have a decreased immune response, and so maybe aren't manifesting as severe an infection if they do subsequently get that in their lungs and other parts of their body because their immune system has been stunted. So there may be actually a side benefit effect of certain types of these therapies, and that's still very early in our knowledge on that. But we're hearing that a lot out of these centers that have had large number of cases.
So safe to say, to some degree at least, that the further out you are, the safer, the more likely you are to look like a normal person, such as if any of us are really normal, and that 4 or 5 years not having to have active therapy, you're probably pretty safe from that standpoint.
Probably back to normal, and probably at a higher risk of community acquiring it than certainly coming here. And then you always have to balance that with the risk of not getting the right follow-up, getting the right therapies. And then for us, that is pretty simple. That is a much higher risk of not doing what the recommended medical therapy is than of catching this infection because of its low incidence and prevalence.
Well, I think it's really an important point to our listening audience. You can't wait a year or two to go get treatment. And COVID's going to be with us until there's vaccinations and therapy. And that's probably a year or two. And so unless you're going to wait that long, it's probably good to go get treatment now. Other questions?
Yeah, I have another cancer-specific question. Somebody was asking that if a patient were to be in a crowd next fall, is there a safe way for them to do it, or should they avoid crowds indefinitely?
All right, Terry, and then we'll turn to Dr. Hawkins, see what they're thinking. But Chiefs games, Royals games, Jayhawks, what are you thinking?
Well, I think again that practicing physical distancing is probably going to be part of the new normal for any person's life, even those with cancer and without cancer. I think you just need to safeguard as much as is recommended using evidence-based knowledge. And when Chiefs games reopen, when baseball games reopen, they're going to take all that knowledge and apply that. It's probably going to look differently than it does today, and I would follow those guidelines. I think a mask, like what Dr. Hawkinson mentioned, I think a mask is probably a prudent measure when you're in that close of environment with that much cross traffic. And then always absolutely vigilant about hand hygiene. Those are probably things that are going to be good for us, not only during this crisis, but any future crisis. And so I think those are smart measures.
Yeah. David, what are your thoughts around some of that? That's really a large scale, kind of almost a modeling question, really. When you step back and look at it, we've learned a lot from some of these big group gatherings, whether it's a meatpacking plant,
Yes.
Or whatever. What do you think about big groups?
Yeah, I think we know the impact on the spread of infections when people gather in large numbers, and it's definitely that the risk of transmission is higher, whether it's in the workplace or otherwise. And I think that the advice that Dr. Sui gives is probably very spot on, very reasonable. Is that it's going to be part of all of our lives for some time, and I imagine the fall will be no different than now. And that there will be a need and a benefit from the physical distancing components of all of this we call it non-pharmacologic interventions, but right, the things that the public have been doing to bend the curve. And I don't think that will change by the fall.
Yeah, I think that's right. Nate, other questions? Or anyone else?
Yeah, so this is kind of a day-to-day question because this is regarding daycare and young children. It's like we know that young children are not able to practice social distancing. Do you think that
Old children can't practice
at any
social
time in the
distancing.
next few months it would be safe for children and daycare staff to return to the daycare setting?
Okay, Nate, we're not going to let you ask any more questions because some of these are just too hard. So, Hawkeye, what are you thinking?
Again,
And I would just say,
question.
adults, like old men like me, who like to go out and do stuff like go to Royals games. I don't know how I'm going to do with some of that. So how do you think little kids are going to do?
Yeah, again, we know little children don't practice physical distancing very well. We know that children may exhibit some symptoms, maybe mild illness. For the most part, really don't get the severe illness. They may hardly have any symptoms at all. So it's really tough because a child may have it and be able to spread it without even knowing it. The family, the parents may not even know it. It's very difficult. As we start to open up now, people are going to need more childcare so that they can go to work and do things. I think in those cases we have to see again what the public health guidance is as we go through our phases of opening up and lessening these restrictions. Again, continue to take as much responsibility as you can to be vigilant in doing the things that you can do. I know it's very difficult because the children aren't washing their hands regularly, things of that nature. It's going to be, again, risk versus benefit and what you can do, because you need to work, but your child needs care as well. And I think it's just going to be a day-to-day thing, and you have to judge how safe is it going to be for my children to be able to do this, for me to be able to do this so that I can stay well, so I can continue to work. And I don't think we have a panacea answer for this. I think it will be a continued step-by-step thing that we reevaluate on a daily basis.
And a lot of it depends on the risk factors of the family and who else has what diseases going on there, because there'll be such a potential to bring things back in. Well, Nate, I think we have time for one more question.
So we talked about going outside. Somebody asked a pretty simple question. Can the virus live on surfaces outside, like picnic tables, swings, etc.?
Okay, Dana?
Yeah, this is a better one. This is good. So, as Dr. Sui even
That's a better
said
answer.
about a different topic, but we are getting more and more knowledge every day. We have a couple fairly good studies, but they are, for the most part, lab condition studies or in the hospital studies. We know that the virus can be detected in different areas of the hospital. Doesn't mean it's infectious, or is it just picking up the genome? Are we just so sensitive in our tests that we are really just picking up parts of the genome, the nucleic acid, and not really picking up infectious virus? We know that there has been a good study, although again, pristine lab conditions, about how long it can live on surfaces. We would hope as we get further and the things such as humidity change, possible, sun, UV radiation, other environmental factors, that the virus won't live on the surfaces for an extended amount of time. I would certainly think that, an hour or two it might be viable. But again, during that hour or 2 or 3 hours, the concentration of that virus, about its infectious virus, is probably going to be decreasing as well. So as we get further out after, say, it's been inoculated or placed on a surface, especially outside, like on a picnic table or pull-up bars or whatever exercise equipment might be outside. I know that there's some around Kansas City. As we get further in time, say an hour, 2, 3 hours, 4 hours, the chance of that being infectious probably goes down quite quickly. But we still don't know the full answer to that, and we're still looking at that. But we would think that the concentration and the overall infectivity will decrease, especially out in the environment.
All right. Well, folks, thank you very much for joining us. Dr. Sui, last words of wisdom for cancer patients and from your perspective about cancer care.
Yeah, really, if you're having symptoms or problems, please get a hold of us. Please get a hold of your primary caregiver. Again, the risk of delaying a diagnosis, a risk of affecting your outcome because of disease such as cancer is much, much higher than the risk of this infection right now. So,
yeah, that makes sense. David, you're the modeler. What are you thinking?
Yeah, well,
We're going to open up.
Yeah, we're going to open up. You might be shocked by this, but I feel like we're slowly getting enough sort of positive signals that it feels like we probably are in a good place right now. This level of hospitalization and level of infection is one we can manage, and opening it up will likely change that. But I hope and think maybe even it's reasonable to expect that impact, that increase, is not so much that it taxes the system and creates a capacity issue at hospitals. And I think that's a good thing. That was, again, one of the key points in instituting such tight physical controls and social distancing measures early.
Yeah. Well, again, as we do start to open up, and that was a good question about how long does it last on the surfaces, as we are out doing more things, if we're out in public, if we're able to go to gyms or being out at restaurants, it's important to continue to maintain good hand hygiene. Do not touch your face while you're out in public unless you've just used alcohol gel or washed your hands. And if you do that, you are really going to decrease your chance of getting the infection.
As we do face reopening, I think we have to remember the words of a very wise and sage, world-renowned scientist, Travis Kelce, the tight end of the Kansas City Chiefs. You have to fight for your right to party. What does that mean? It means you still got to stay safe a little longer. You still got to fight through the urges to go out and do the stuff you shouldn't do, because that's what's going to keep you safe. Fight for the right to party. Stay safe. Thank you all. We'll be back tomorrow.